Hey there, hi there, ho there, everyone. Welcome. My name is Dr. Carolyn Rowley, and I am happy that you're here. I am the executive director and founder here at Cayenne Wellness Center. And so we're glad to be with you all for our first mini seminar. And just to let you know, we are in California and we take care of folks living with sickle cell disease throughout the entire state with the help of our compassionate community health workers and our MSW interns and the entire staff. So this is done because of made possible, of course, through the works of our program manager, Mary Alcacer, L. Cole, our senior marketing manager, and Major Effects Communications. So we're thankful for them as well for the technical support. All right. And so mini seminars. We began having these mini seminars, gosh, I think it was 2019. And it was after Dr. Ebony Lance gave this excellent, awesome talk on the brain and sickle cell disease, and everyone wanted more. And so we did not want to wait till the next year for the summit. So we developed these mini seminars. These mini seminars, MINI, mini seminars, we have three. And they usually have different topics, different themes. This first one is on diversity, inclusion, and sickle cell disease. And we're going to be talking shortly about care for the incarcerated. I'm going to share with you how this topic came about. We also have, and we did these mini seminars are three. So we actually offer them 3 times throughout the year so that we can actually really have an in-depth experience. And then we're also going to be doing mental health. And so it's always important to talk about mental health as well. So we invite you all to always come and see and check us out. The third one that we're going to be doing is advocacy and empowerment. And this year we're connecting with SCAASF, Sickle Cell Anemia Association San Francisco. And so that is run by Nadina and Antoine. And so they've been doing the advocacy and empowerment for a few years now. And we wanted to be able to partner with them to shine the light on what they are doing and for us to be able to offer that through our mini seminar. So, in addition, we have Author's Corner, we have our summit. Save the date. It's going to be in LA, California, September 18th through the 21st, 2024, in Torrance at the Torrance Marriott. Mark your calendar. And we have our Wednesday webinars that'll be coming up, 504 IEP in August. We'll also have our SED and suicide prevention in December. And that's been moderated by the lovely Dr. Lori Vick. And this will be the third year that we're doing that. So I think you guys know us for the education we put on and we provide. So this is our first one. Welcome. All right. Let's talk about the care for the incarcerated. And so this came to my mind. I mean, I think I've always thought about it when we know that on occasion the warriors are in jail or in prison. But about 5 years ago, I really wanted to do something. I really wanted to gain more information, and there was nothing there. So I have been speaking with SEDC and also the CDC to let them know this is an important topic, and it'd be great if we can just get some data to find out on average how often are warriors going to jail or are they in the penal code system? And then beyond that, what's happening? We know how tough it is to be able to get evidence based care when you go into the hospital. So, is it tougher when you're in prison? Is it better? Do they have easy access? We have no information. And so I'm excited. So that's how it came to my brain about 5 years ago, right? And I like for us to get data. But also, what was wonderful is that I was interviewing Andrea Matthews, and she was sharing with me what they're doing in Pittsburgh. I was so impressed. And I decided, you know what, from now on, I'm going to need to meet with some of the SCDAA members throughout the year just to see what they're doing, applaud what they're doing, see how we can actually partner. And she mentioned this program. And I said, oh my goodness, do you know that this is something that I didn't want to reinvent the wheel? I just didn't know how to do it. So you all will get an opportunity to hear from later Michael Matthews. But first up, like for all of these different mini seminars, we do have a moderator, and we also have surveys. So we want to know, um, did you enjoy this topic? We want to know if you have ideas for other topics. So we want you to please fill out those surveys so that we can know how well we're doing. Um, but we have our moderators today are Tristan Lee, and unfortunately, Tanya Gentry is not able to join us today. And so, if you all can send up prayers for her healing. As a warrior, you know that sometimes things just come upon us, and so she's managing. So hopefully, we'll see her the next time for part two. But next up, Tristan Lee. If we can bring him up. Tristan, I am so glad that you are joining us. And so we're excited that you're in this role. What I can say is that Tristan has been part of our transition program that we've been doing for the last 4 years now. And so we thought about you and we wanted you to, uh, you know, moderate and help us with this conversation. Tristan, can you introduce yourself? And then after that, if you can introduce our guest speaker.
Of course, and thank you so much, Dr. Raleigh, for thinking of me for this. Thank you so much for always having me be a part of these wonderful seminars and these wonderful presentations. I cannot, just tell you how much it means to me to be thought of and respected in this light. Ever since I've met you at the SCDA conference, I've always just saw you as this like bright light. And every time I think of you, I just get filled with such joy. And I don't know if it's because I know you're in California where I want to be and it's everything out there just seems so peaceful and zen. But you always give off that presence, and the organization Cayenne I love. So I just wanted to say thank you. Of course, we are definitely keeping Tanya in prayer, and we know that she will be healed by Jesus' stripes, and everything is going to be okay. Now, everybody, my name is Tristan Lee. Some of you might know me, some of you might not. Everybody calls me Divo, D-I-V-O, as you can see on the screen. So if you're my friend or if you're just now meeting me, it's just Divo. That's what I go by. I am a sickle cell warrior, type SS. I am 40 years young, living well with sickle cell by the grace of God. And I am a fashion designer. I am a stylist. I am a professional patient advocate. I am a professional model. I'm an actor, and I'm also a new author. I just came out with my first book called I Have It, It Doesn't Have Me, which was published in October 21, about my journey with sickle cell disease up until the age of 19. Part 2 is coming, so please look for that. And yeah, that's me. And like I said, I'm just so grateful to be a part of this conversation and the ones that are coming, because everything that you were just talking about, Dr. Raleigh, I'm so here for the mental health and all of it. Like, I cannot wait to get into those topics as well. So just thank you for that. And today, I'm so excited to talk to my friend, and somebody I consider a mentor, who I always have looked up to and adored since meeting him and his wife, Andrea. I am talking about Michael Matthews. He is an amazing, amazing man. He does so much for the sickle cell community up here where I am in Pennsylvania. And, I just cannot say enough about him and his wife and everything they do ever since I met them in Harrisburg on the Capitol. It's just been amazing, and I will always, always give them my utmost respect. So, Michael, thank you for being here with us.
Thank you for having me, and I appreciate you, Dr. Raleigh, and obviously you, Devo. Devo is brand new to me. It's always been interesting, but as you guys know, you're family, so we're all family.
Yes, definitely. So, Michael, can you please share with us about how everything came to be with the organ, what you're doing, and how you guys kind of came up with this great topic and great, everything that you're doing with the care for the incarcerated?
Right. Well. First, I want to give credit where credit is due. I have a great counterpart over in the Philadelphia region. Anyone who knows about Pennsylvania, Pittsburgh is on one end, on the west end, and Philadelphia is on the east end. But we have a great partner out there, Miss Zamoria Brandon. She was the one who really started. Having questions about what about if an individual or a warrior in this case happens to be incarcerated, and we really started to dive deep. I'm happy to say, and I'll give you guys kind of a lay of the land. I'm happy to say that now we pretty much have a task force between the east and the west, and we're trying to invent and recognize and put on paper what are some of the best practices using ASH, American Society of Hematology, their care model, and what that all entails, and trying to spread that within the penal system here. We're starting right now with some of the state institutions in Pennsylvania. Unlike where you are, Dr. Raleigh, you guys might have more. I'm not sure, but in Pennsylvania, there are 57 state correctional institutions, and I do believe Pennsylvania is one. They have more than any other state. That's not necessarily a good thing, but to give you a little bit of background, working through the Pennsylvania, the PASCPN, the Pennsylvania Sickle Cell Providers Network, which is a conglomerate of a lot of community-based organizations that are there uniquely to provide services for sickle cell. That's how me and Miss Amore kind of came to be. But we know this is such a hot and critical topic, especially if you happen to be that warrior or a loved one of a warrior who happens to find him or herself in that situation. I don't, a lot of times when we talk about the penal system, it's not only a male thing that's happening. There are, unfortunately, a lot of our women find themselves in this situation. We want to make sure that they're getting the best care. So I'm going to be happy to share with you guys today our journey, and hopefully you could pick up some nuggets of knowledge on it. And I encourage anyone who's on the call to share in our chat, ask questions, because we know we don't have all the answers, and we can learn some things from you guys as well.
Definitely. And oh my gosh, I love Zamoria. Like, you saying that you and her are like kind of the brainchildren of this. I can totally see that because Zamoria is such a power player in Pennsylvania as well when it comes to sickle cell. So it's just like this is like the perfect marriage
It
of
is.
all my favorite people.
And I wanted Devo, I wanted to just chime in. So I've asked if they can bring Zamoria over because we didn't know that. And number two, while they're attempting to do that and get her on this side, Michael, can you um, tell us a bit about you and Andrea and how you all started your organization? And then you guys will be able to dive in, and hopefully Zamoria will be here as well, because people are here because I think they too have thought about it and they just want to know what's going on. So you guys are literally giving us the lay of the land.
Okay, well, I'll give you a little history, and I'm sure I'm not going to do it justice. My beautiful wife, Andrea Matthews, she started the Children's Sickle Cell Foundation about 22 years ago when our son was born with sickle cell. It was unexpected. My wife, she knew she had trait, did not know that her husband at that point in time had trait also. Hence, here comes Jonathan has sickle cell disease. We found out in Pittsburgh, unfortunately, there was one organization that was already in place, but they only took care of adults. So it left a gap in services for my wife to start the 501c3, an organization, the Children's Sickle Cell Foundation. Over the years, over the last 20 plus years, I would like to think that we have been very innovative using technology, just really working with our population. You guys will hear me say on this call, I really don't refer to individuals with sickle cell. I either say warriors or family. We don't call them patients because we're not physicians and things like that. But we really listen to, and it's not surprising, we listen to our families or our warriors. They are the ones that may have a lot of the answers that we're looking for. They have a lot of the experiences. So, first and foremost, on this topic about the incarcerated, I am asking some of those individuals who unfortunately found themselves in that situation, what did they need? I'm not in that situation. I wasn't incarcerated. And I don't want to speculate on what they did have and what they needed to have. So we want to incorporate their feelings and their needs and desires and everything with the ASH, the American Society of Hematologists. We want to look at their care model and make sure they line up. But it should be for an interesting topic.
Definitely. And, I think I shared with you both before that my mom was a prison guard for 17 years. She actually retired from that job as a correctional officer at one of the correctional facilities here. And during her time working there, she would come home and sometimes she would be really distraught and upset about, seeing some of the incarcerated people in that system that have sickle cell and how they were treated. And she would always tell me, like, Tristan, like, all I want you to do is just make sure that you never, ever become incarcerated because the care that they give you in there is terrible. She would tell me how, warriors aren't believed, how the guards just think that the pain is not what it is. They will literally give somebody who is in full blown sickle cell crisis a Tylenol and send them on their way. And these people are telling them that's not, going to help me at all. And that's just like not even scratching the surface. Like, we need actual care and strong pain medicine, and they just refuse to hear it. So, with that said, I just thank you so much for kind of being here and caring for those people, because I know I've heard firsthand these stories, and it's just heartbreaking what they deal with in there.
Well, when you think about it, Devo, when you think about it, that's pretty much how it is walking around in the everyday life in the average emergency department,
Hmm.
room. If you show up, I mean, if you have a good experience, I mean, I don't know how many people would ever have a good experience going to the ER for any reason, but it's a shame that we run into physicians and staff who don't believe or don't know that much about sickle cell. You're sitting there like I can barely move. My legs won't work. They feel like they're on fire, and they look at your legs and say, "They look. You don't have any broken bones. They look pretty normal to me." A lot of our physicians, unfortunately, don't understand. Um, but I would like to give them sometimes the benefit of the doubt if they actually did understand and they were knowledgeable. I would like to think as human beings they're going to be a little bit more sympathetic to what we might be going through. So imagine that with prison guards who already, I think, by nature have a little thicker skin.
Hmm.
But by the same token, to get them to act on your behalf requires, unfortunately, that much more work.
It really does. And like, I know one story, my mom said that there was a woman that got a crisis in the middle of the night, and they wouldn't even give her a stretcher. So they kind of, even though like she couldn't walk and could barely breathe, they still didn't have a wheelchair for her or anything, and they still made her get up and walk, to the ambulance, which was out the gates. And it was
Right,
just horrible. Like, it was dead winter, and sickle cell and
right,
winter, the elements don't mix like that. So this woman who was a senior at this point, was just in incredible amounts of pain. She spent probably, I think my mom said, 5 days in the hospital. And even when they are in the hospital, this is something else that should be pointed out. When they go to the hospital as incarcerated people with sickle cell, they're still not in the complete comfort because they still have to be handcuffed
Yeah.
to the bedpost. You know what I mean? So it's like you're already in, you know, other people's hands. And then at the same time, you're still being treated as if you are the lowest of low and being chained to a bed in one hand and then an IV and people just doing whatever they do to you, you know what I mean, in your body in the other hand. Like, it is horrible, and like it just breaks my heart even to think about it.
right.
So
Well,
yeah.
I'm gonna give you a little example. So how we started Zamoria, and we were always having these conversations about the incarcerated, and we knew, unfortunately, that there was a particular population that found themselves in that situation, and we were asking ourselves, how can we make sure that they are getting the best care at the same time, and my wife Andrea, we're sending out surveys trying to make sure that we can receive adequate care in emergency rooms across the state. So you can only imagine. Now we're talking about dealing with jails and things like that. The reason why I mentioned to you about Pennsylvania has 57 uh, county. It has 57 counties, and interesting enough, almost every county has a jail. Not to mention all the local municipalities that have jails, but
Mhm.
usually when it's a county jail, there's a medical officer. There's a chief CMO, a chief medical officer that's assigned to that. Um, how we did it here in Pittsburgh, and I'm ashamed to say uh, we made our biggest strides when we had some of our warriors that were complaining about the treatment they had received. They were complaining either once they had gotten released and or they were complaining, they were sharing with their loved ones the situations and the conditions, which then we have a relationship with the loved ones and the family. So then we sprang into action. And to give you an example, just how um, sideways things can be, here in Pittsburgh, two of our big medical providers are UPMC. It covers all of our adults and it covers our children at Children's Hospital. And then there's another big healthcare provider called Allegheny Health Networks, just as big, just as good. Well, we have the specialists at UPMC with Dr. DeCastro and Dr. Novelli, but the contract for the county jail was under Allegheny Health Networks. Well, interesting enough, um, they were, and this is some good news I want to share. When we finally kind of cracked the code and said we need to get in there and start advocating for our families and our people that are going to be coming through there, unfortunately, they were very welcoming. I was surprised by that. They were like, but what they wanted was they felt that they did not have the right education to treat our families. And I think that that happens more. If it happens one time, it's too many times. But I think a lot of times these physicians and these doctors and these caregivers, they just don't have the knowledge, experience, or expertise to work with our families. So what happened was Dr. Not Dr. DeCastro, Laura DeCastro at UPMC, she scheduled once we found out, and oh, I gave I, I gave I gave her presentation. I gave her presentation. Uh,
Well, hold on,
along,
Michael. Debo, can you? Perfect. Thank you.
along, I gave a presentation to the board. Every incarcerated center or like a jail, they have a governing board. So I gave a presentation to the board saying, hey, we have a couple individuals in there, and this is how bad it is. I thought we had two or three people. I then went to UPMC adult, and they said, no, Michael, we had six people in there at the time. And they said, we definitely, if you can get us a meeting, we want to go down there. And then they met with their chief medical officer. And I'm not going to say it's been great since then. It's gotten a lot better. Once you meet with the CMO, they were surprised to find out that the facility, they really had a nice facility on there for, if a person was incarcerated where they could receive medical care. Unfortunately, as you guys know, I'm preaching to the choir. A lot of times we're talking about some of the pain medications being controlled substances. So that became an issue. And how could we secure, making sure that when you give a incarcerated person, a patient, these pain pills, that they are taking the pain pills. You've seen the old movies about they put them in their mouth and they call it cheeking them. See, I got some new language when I was down there, and they cheek the pills and then they spit them back out and do what they do with them. I'm not really sure. But anyway, I said, I'd rather you do that a million times over and they spit them out and cheek them and do what they do than not give that patient or not give that warrior the medication that they need and deserve. If they make that choice to not do, then that's on them. But to withhold and not give them their medication, that's almost inhumane. Um,
Michael, may I? So I want to go back because everyone's listening. So the chief medical officer is the CMO at the jail.
yes,
Okay, so there's 57. So
57.
that means at some point, talking to the CMO at every one of those at some point, right?
Right. Well, no, what we're trying to do, and with Zamoria's help, we're trying, because all these are state correctional institutions. There's 57 of them. You could probably throw another 57 because you have county, you have not county. There's 57 counties, but you have little municipalities. But 9 out of 10 times, the way it was explained to me, if you're one of these small municipality jails, you're not going to be there for very long. You're going to be there for 1 or 2 or maybe 3 days. Then they're going to send you to the county jail. And that's where we're trying to, with Zamoria's help, we're meeting with the Black Caucus up at the Pennsylvania state legislators, trying to get them to put an umbrella on the standard of care for anyone who is incarcerated. Because here's the other thing, a lot of people, a lot of our warriors, they have monthly or bi-monthly clinic visits that they should attend with their hematologist at their center. Um, and we want to make sure that you're not going to say, oh, we couldn't find any transportation for them, because when they transport them, they have to have, well, in Pennsylvania, they have to have 2 guards that go with them anytime they leave the facility. And Tristan, you were saying, yeah, they got to be handcuffed, cuffed, and shackled and everything else just to go to their routine hematologist appointments. Um, so it's not perfect. I think we got a lot of work to do, but it is getting better. Just for the fact that Dr. Rowley, you providing this type of forum for people to know that there is there is light at the end of the tunnel, and it's not a train. Like we hopefully we can share some of these practices with you guys, and they can start to institute them. And I do believe if we get in touch with this Pennsylvania state legislators, they can mandate that, hey, this person, if he or she has this condition and it happens to be sickle cell, just like if you had cancer or if you had dialysis or something like that, and you found yourself being incarcerated, they couldn't withhold treatment from you then. And, we're looking for that same type of stature to make sure that, our warriors get what they need.
So, okay, so you mentioned the statute for cancer. Does it specifically say cancer, or
Uh,
does it say people who need medical attention?
Well, I can't speak too much to cancer, but I'm sure, and this is just a educated guess. If you had dialysis and you were incarcerated,
Mhm.
they would have to get you dialyzed. They
Mhm.
automatically, and it's the same way. I look at it the same way. I'm going to set the bar very high. If
Mhm.
you happen to be a person, a warrior,
Mhm.
you need your sickle cell care. And you could tell me that 15 guards have to walk me up to the hospital, whatever it takes. You make it happen, or you could let me go and I'll get there on my own. It's either way. But yeah, we're just trying to really raise it to the level, if a person had cancer, how critical they are and how they make sure the appointments are made, medication is available to them. Like I honestly believe, and this is not from experience, but if a person has cancer, I'm sure they have pain meds that they take too. And I'm sure that they get their pain meds. So I want to make sure if one of our warriors has a a care plan for their pain, I want to make sure they're getting their medication as well.
Absolutely. It's just so important. Like I know with myself, I get monthly my blood checked monthly. I go see my hematologist monthly. And so I just think that that is such a vital part of really living well with sickle cell. So I'm thankful that you are really pushing that envelope to make sure that the incarcerated warriors are also getting that same fair treatment. Um, I just, I want to continue to speak on the important part about, I know you said cheeking. So how does that go if when they're trying to give care to somebody who was incarcerated that had maybe gone in on like a charge for narcotics, like does that ever become like a blurred line, or is that like a whole nother fight that you guys have to endure and take on for that person?
That is a very good question, and to be quite honest with you, I don't know how that happens. I do know that one of our individuals who was incarcerated uh, was accused of doing that very same thing of cheeking the medication, and I was like, that's beyond our control, really. But I've had several conversations with this person since they fortunately have, they've done their time, they're back home, and I'm sitting there telling them, you might not want to, because they were telling me like, oh, there was a draft in the cell block I was on, and all these different type of things. I say, well, I can't get into that, but I guarantee you this: if you never go back to prison for any reason of your own doing, you don't have to worry about a draft. You don't have to worry about, them not giving you a fluffy mattress to put on the cold, metal that you sleep on, which, like you were saying earlier, Tristan, that we know that's not going to be good for you either. And when if it's drafty, you're not really going to be able to control the heat or the thermostat while you're in jail, things like that. So we don't talk about it much with a lot of our people, but for some of our, to be quite honest with you, our adult population, some of them have shared that they've been in that situation. And, we'll be in a room with like 15 warriors. And I say, well, that's a good enough testimony right there. Why you never want to find yourself incarcerated. Now, we know that sometimes people find themselves incarcerated that did nothing wrong. It's just the nature of the beast, unfortunately. But by the same token, it's like I can only advocate for you so much. I can extend my arm, and we always say, and I'm glad to hear you said earlier, we want every one of our warriors to be living well with sickle cell. But you gotta kind of help me. I'm pretty tall. I got long arms. I reach out as far as I can, but you got to take your hand out of your pocket to grab my hand for me to help pull you up. You know.
Michael, I wanted to, so I'm going to pin that and come back to it. I want to look at what's going on in our comment sections,
Okay.
and then I'm going to come back to that because I say that we say the same thing. Let's take it from yes. So Zamoria is saying working on collaborating with the PA Legislative Black Caucus. This is for everyone in your particular state. The PA Prison Society, which I did not know that there was a prison society. So we're going to have to check that out here in California, and the Center for Returning Citizens. And so I'm assuming that that has to do with those who were incarcerated um, wanting to return
Right.
uh, as a citizen, and perhaps there are some of those folks who may have sickle cell disease. So this is good. Thank you, Zamoria, for sharing what the collaborations look like in order to get this moving. Let me just read a couple of more, and then we'll continue the conversation.
Right.
Yes, and Ms. Brandon also says sickle cell is not on chronic disease registry in Pennsylvania. Also, the recidivism rate is a major issue. Um, so you guys have seen your particular warriors go in more than one time?
Unfortunately, yes.
Mm,
I would. We don't have the numbers, but I would say I would like to think not more so than the average individual or population. It's not like if our warriors they go back 7 times and the other person, who's not a warrior goes back 5 times. I don't think that's the case. And the ones I know of more intimately, I know them. I know the families. They have vowed never to return. So that's a good thing. And the other thing that Zamori has shared, as I was saying before, in working with the Pennsylvania Legislative Black Caucus, we're trying to really get sickle cell on the same. And like I said, if I could compare to another issue or situation, I would. But like cancer, how seriously they respect and treat and I don't want to say make allowances, but I kind of do want to say make allowances for those individuals who are unfortunately living with cancer as well. Um, and I'm sure we have some people, some of our warriors, unfortunately, throughout their lifetime, some of them have battled both sickle cell and cancer.
yes.
And I just don't think that you know we are trying to impress to our legislators and anyone who will listen. Sickle cell was not a choice. You didn't do anything bad or anything like that. And it's a chronic. You're going to have it for the rest of your life. Just because you don't see us on the news and we don't get a lot of the headlines and things like that, doesn't mean it's not just an awful situation that a lot of our people, that are fighting so hard to just live safe, productive, healthy lives. And as Devo has said, living well with sickle cell as we wish upon all of our family members and the warriors.
So I want to go back to that pin I mentioned, and then so we have where we are we? I thought I saw something. There it is. Um, awareness. No, it was earlier. You guys. Oh, I saw something about when you come out as a returning citizen, you need additional support not only for your sickle cell disease, but being able to integrate back into the community. So far, you guys are saying who we need to collaborate with, number one. And then even when they come, so you need to collaborate. We need to provide training
Right.
for those who are in so that they can get evidence based care. And then also, you guys need to have um, support, financial support to be able to help them when they actually come back, because now it becomes even harder than ever to try to find a job, to actually enter back. So you're saying that that's also additional support. But I'm going to get to the pen and then turn it back over to Devo. So you were mentioning help us help you. I agree. Um, we know that when you go into the hospital, we know that it is not an ideal situation.
Right.
We know that sometimes tempers flare, but we always say, unfortunately, even though you should have a voice, you can't curse people out. You can't threaten. You can't pick up something and throw it. And so, unfortunately, what we've seen when you do that, they can go a step beyond calling the security. They can actually press charges. And so, this is real. And this can land someone, unfortunately, in jail. So, don't get me wrong. We all understand. I think we're people who are here are the choir, so they do understand that warriors are not treated well.
Right.
And so even when they're being advocated for, they're still not believed. They get less than. And we have warriors who, particularly the men, who say they're making me feel less than a man, and um, and they're crying, and they're unfortunately they're breaking them down. He said they're breaking me down. And so this is real, and it may wind somebody. Unfortunately, we're trying to keep that person calm, but we can understand how things sometimes may spin out of control. So I wanted to just kind of go back to that help us help you, because we can only do so much. Um, and that just has to do with when you're in the hospital. This is not even outside of the hospital and how they live their life. Um, and we don't know what they're doing. But I'm hoping that every warrior who hears us, or someone turns them on to watching this, seriously, we're in this space because we really do care. It goes beyond care. We really do love you. We really want you to live, and to live with purpose, and to be pain free. We really want that. And we know that it's hard.
Hmm.
And I agree with you, Michael. Help us help you, because we really can only do so much. And so, again, we're thankful for you and Miss Brandon and your guys' partnership together and sharing. So I'm going to stop there because we want to hear more about how you all were able to get this task force started, how long it took, and what are the roles that people play.
Well, let me just comment on one. Terry Pacella, she is a social worker, and like I said, anyone and everyone can be your friend. Terry Pacella is a social worker on our adult side, and she was the one who was really active in getting these meetings set up and getting the tour for Dr. DeCastro to go down to the facility and tour the facility and look at what medically what they had and what they could do. Uh, this is, I think, this is kind of a breakthrough moment for us. And like I said, we got a ways to go, and we're not stopping here. But Terry became our point person because when we talk about being incarcerated, we're not no longer talking about pediatrics. We're talking about the adult population. She be naming her as the contact individual for the jail to reach out when they say, "Hey, I got Joe Black here. He just got, and he's reporting he has sickle cell. Well, they can call her. She's the point person, and she could tell them, "Oh yeah, we have him on our register." And then, as a matter of fact, he's supposed to come to see us in 2 weeks. How long do you think he's going to be there for? Because if it's more than if it's she can tell them we need to start to set up the transportation issues and all that because a lot of them need lead time, but it also was just important for the actual facility to name a point person for them as well. So there were never two ships crossing in the night. It was like, no, Terry would call Bobby, and Bobby was the point person for the jail on the administrative side so that they could kind of get the ball rolling. But she was very instrumental, and that made a whole bunch of sense because I'm sure the administration at a jail like here in Pittsburgh, not that we're a huge city, but I'm sure you might call there and you might talk to one of 15 different people. And if you talk to person number one, you had an agreement, but next time you call, you're talking to person number four. See, you don't have that agreement. That's why, trying to synchronize them communications on behalf of our warriors that were going to be in that situation was really important.
Wow. Okay. So social worker
Yep.
having a contact person that
Yes.
that the jail knew to call. So they know
Right.
to call your organization and then the person in your organization. That's
And
important.
right. And what they did when we talked about the recidivism, uh, when a person is about to leave a facility, if for some reason, like I said, we're 22 years old, so you might be 35 and find yourself in that situation or whatever. Maybe you weren't connected with our organization. Terry's job, we're making sure between Terry and myself that we are getting in contact with them prior to them leaving, saying that if you were not involved with our group before, so we could advocate for you in life, period, not just in while you're in this situation, but just help you, maybe help you find a job, maybe help you get training, get your GED, whatever it is, we want to be there for you. So sometimes, and I hate to say it, when a person is in that situation, they are seemingly to me more grateful for your help and your hand up. They are more willing to talk with you because they're trying to get on their feet. They're trying to, make sure they're never in that situation again, no matter how they got there, and their ears are a little bit cleaner and they will listen to you a little bit more and they will take your advice and words of wisdom or whatever, or just refer them to different programs and things like that, because once again we always let them kind of drive the bus, so to speak. I'm like, you're going to take, but I'm going to supply the power, I'll push the bus, but you're going to take us where you go. Do you really want to get a job? Do you really want to get your education? Whatever it might be, are you really looking for housing? We'll do all them type of things with you and for you, but you're going to have to pick up the phone, and when we do call. So Terry is very instrumental in that part as well.
Let me read what's in the comment, and I'm going to turn it over to Devo. Woo, there's been so many comments. Let's see, so I can share with the tech team. Let's talk about language. So Miss Brandon said that language is important, and so and you guys, it's so true. Even language for sickle cell. We stay away from using sickler. We stay away from uh,
Right,
we stay away from frequent flyer. So we want to also be mindful of this language with respect to um, the penal system. So she says, so the former terminology of ex-con, ex-offender is no longer acceptable. That's why the term returning citizen is appropriate. Let's make sure that we use that, everyone, because the TV and movies say things like that, but
right.
we don't want to fall into that, and we want to call our warriors when they come out returning citizen. Thank you so much for that. Pat says, is there a possibility of having certain institutions certified as sickle cell competent service providers through the state or federal prison system that includes hospitals and prisons?
From I would say from your lips to God's ears, we would love that. I mean, forget I would love that. The fact that I think it would be so helpful to our warriors. But unfortunately, at this point in time, we haven't achieved that thus far. And to your point, Dr. Rowley, that's why Andrea came up with this ingenious thing when you talk about like ex-con, citizen. A lot of them don't like the word inmate. So I know all these words. We just call them family because guess what? You might be in a crowd, you might be in a grocery store, and I don't even want to call you a warrior. I just open my arms and say family, like I'm expecting a big hug. They
I,
don't know how we're related or how we're family, but I want anyone who's watching to know that's how I'm going to receive you and that's how I'm going to treat you as family. Uh, so that's one of the things. But back to what you had asked, there right now, I don't think we're just trying to do it in Pennsylvania, and hopefully it'll spread from here. I think that whether it's Ohio or California or Nebraska or wherever, Georgia, if we can do this and have a good model, other places will be more likely to join once your model is complete. And they'll say, okay, but we're from such and such a state. We got to add a twist to it because of the way our penal system is set up. That's fine. Put your own thing on. But we want to be able to deliver it to you once we get our T's crossed and our I's dotted to say, this works most importantly, it works for our warriors. And I understand that sometimes you're going to have to take what will be our finished product, even though it will always grow and it will always metabolize and be different for everyone. We want to be able to give you a complete package and then you fit it into your state or your county or whatever it is. But getting that overall, like the ASH, the American Society of Hematology, now that they came out with these care standards, these are the brightest of the bright. So you can't really tell me that, oh, no, that doesn't really, you got to explain why that's not going to work for you because this is what's best, what, no matter what it might be as far as care for their particular families or, patients.
real quick, Pat Corley says, so you guys do the adults. This is needed in the juvenile justice system as well. Are you guys involved with the juveniles?
I would say no, unfortunately, and this is why. Over the last 3 years here in Pittsburgh, they closed down the juvenile facilities. So there's not even anyone to work with right now. Um, and you know what? I would like to think that if there, because they're talking about opening a couple, but if there were, or in your area, if there are juvenile facilities, I would like to think it's been my personal experience that when you're dealing with adolescent, when you're dealing with young people, they are more sympathetic. It's I don't want to say it's easier to make change, but I want to say it's easier to make change because when you're dealing with adults, they figure like, hey, they put themselves in this situation, they just got to grin and bear it. But I would imagine if you have a pediatric facility near you and you go in there with some information and some education, I would like to think that professional staff, whether it be social worker, whether it be their medical officer or whatever, be like, oh, please, because the first thing that the medical officer for us at this adult jail said was, can you bring your staff down? The first thing we want to do is be educated about sickle cell disease. And this was he was a doctor. He wasn't a hematologist, but he was a doctor, but he knew the importance. Like, I can't really expect my staff or anything to do that without the training and expertise. Not that there would be any certifications or anything, but just we would know better how to work with and for our people who are coming in.
Yep. And see, that's exactly what I was going to say, that question that was just asked, because I thought when you were talking about like the pediatric care, and we all know that pediatrics in the sickle cell community kind of get more attention than the adult. And for 3 years, I was a peer to peer mentor with the SCDA. And I remember working with some of those, kids as they transitioned from pediatric care to adult care. And they just really were so um, impressionable, and they were really absorbing everything that I was saying to them. So my question, and I know you kind of already answered this, but if a juvenile is in the system and goes through or is transitioning to adult care, let's say like they're
Right.
17 and a half and they're still incarcerated, right, in the juvenile system, how difficult is it for them if they have to, if they're not getting out for maybe like another 3 or so years to then transition from pediatric care to adult care in the incarceration system? Does that kind of put up another wall for you guys, or is that kind of like just a smooth transition for them as well?
I think it will. Well, when you, for us, because we're a community based organization, because we work with from birth through the lifespan, so nothing really would be different.
Mm-hmm.
The only difference is, as an adult, I'm going to work with you more than I'm going to work with your mom or dad or whoever your caregiver was. Because I mean, when you're talking to one of our warriors who happens to be an 8-year old, are you really talking to the 8-year old, or are you talking to mom and dad who are, or whoever cares for that particular child?
Right.
Um, but you're right. I mean, the transition age is so tough to begin with. Uh, and then you throw in the extra layer of being incarcerated or being in some type of facility. Uh, we haven't gone through that much. Fortunately, I would say this is
Mm-hmm.
one time before we haven't gone through that much. But as far as our care, Children's Sickle Cell Foundation, we would probably just hug on you when you're pediatric. We hug on you a little tighter than when you become an adult. We're just gonna, I'm gonna loosen up my grip a little bit because, because you're an adult. uh,
Mm-hmm.
but when you're young, I can talk about what other folks have done and how they've done it, and it's kind of worked out for them. You could choose to go that route if you want to, but when you're an adult, it does become a little tough because one of the things we say, Tristan and Dr. Rowley, when I deal with adults, all adults say pretty much the same thing. When you're a kid, you get so much more stuff. You get to do things, and it's warm and it's fuzzy. And I say, you know what the big change is when you become an adult? If you've tried to do the right things and you tried the best you can do. And we all fall a little
Mm-hmm.
bit short.
Mm-hmm.
I say, when you go into the hospital as an adult, they say, hey, my job, I tell them, I said, their job is to get you in there, get you comfortable, make sure you're out of pain, and get you better so you can get back to that big, beautiful life you've created for yourself. It's not
Yes.
like, not like, that like some of our kids, and you guys probably, I'm preaching to the choir again, but they have Xboxes and PlayStations, and they're making bracelets, and they're doing all these different type of crafts that they probably don't do at home, or they could possibly not do at home. So
Mm-hmm.
it's like it's comfortable to be in the hospital sometimes, unfortunately, when you're a kid. I mean, but at the same time, when you get older, like I said, if you have like we've gone and we've done professional development at people's jobs because their staff or their coworkers wanted to know more about sickle cell. And we would go in and tell them what it is, what it's not, different things like that. So it's different. But like I said, as long as you when you're hugging on the kid or you're hugging on the adult, as long as you throw a whole bunch of love and care into that, recipe,
Hmm.
it it can really work out well. Hopefully, that's our best way of going about it.
Absolutely. And you, like I said, you and Andrea and Zamoria are some of the best people to hug and to love on.
Right.
I've experienced this personally. So it's just such a blessing that, you guys are in this space. And I just want to continue to say that I'm just so thankful that you guys have even created this and are bringing this kind of awareness because as we know, sickle cell awareness kind of slips under the radar. Like we have, the 19th in June,
Right.
World Sickle Cell Day. And then, of course, we have the full month of September, you know what I mean, which is Sickle Cell Awareness Month. But topics like these, with the incarcerated are just, I feel like something that's pretty nuanced. Like this is like the first time I'm really even hearing something like this so in depth. So I'm just so thankful that this has been brought into my attention. And I'm sure there are other people out there that feel the same way because, especially in the Black community, sometime, unfortunately, in the Black and Brown community, we are, kind of the ones who are more prone to be put into the system, you know what I mean, just for existing.
Right.
And we can say that because, how many times have we seen how this country kind of handles us, you know what I mean? And I know personally myself, like I have family members that have gone in the system from the time they were like 16 and they just got out and are getting reacclimated with society in their 50s. And it's just like night and day, you know what I mean? So I just, like I said, I'm just so glad that you are shining a light on this and we are talking about this. It's just amazing.
Well, I appreciate you guys, and one of the things that I'm so proud to say that my wife Andrea and I, we really listen to our warriors. We listen to you guys. We listen to our families. We don't go out and say, "Hey, we're going to create a program," and then here, get in where you fit in. It's more or less like, what do you think we could do differently or better, or maybe we just want to reinvent one of the programs we already have, like our education support. To whatever it is, we listen to you guys, just really trying to be the solution to a problem, because we think that no matter what, we can get there. If we have your help uh, and your guidance, but the incarceration piece, it's going to take a little bit of time, but we're gonna go at it like it needs to be fixed yesterday, every day. And tomorrow I'm gonna say it needs to be fixed yesterday, and 2 weeks from now it should be fixed yesterday, uh, because I think that's the only way for us to get up to speed. To get to a level playing field, we actually have to ask for more than we want, because we know there's going to be some back and forth in the end. Um, but we got to keep treat each other like kings and queens. That's why Andrea has another great saying, like, anytime we have a meeting where we think there should have been 60 people on it and there was only 40, guess what? We celebrate the 40.
Hmm.
We're
That
not worried about the other people that weren't able to be on it. If there's 4 people on there, I'm gonna celebrate you that much more. Yeah, that hug is gonna get a little tight because I only got to hug you right now. So
Right.
Well, Michael, so you said family. I think everyone's going to take that back with them, kings and queens. But
uh,
I have a question. So Devo is right. Even though some of us have been thinking about it, you all have put this into action. So thank goodness for that. That you did that, and definitely I will be calling you offline um, to get more information. However, data drives
right.
support, financial support. And as I mentioned at the top when we began, that I spoken with SCDC and CDC, and they need to start gathering data. So where do they start? I don't know of any other program but yours, and I'm hoping that this particular topic, this particular mini seminar, people will start thinking about what they can do in their state. But where are they going to begin? Because we have been talking about it for 3 years. I've been thinking about it for five. How long have you guys done your task force for? How many years?
I want to say it's been about really since it's been in place with Zamoria's help. It's been about 2.5, 3 years. We really
Okay.
started to kind of focus in and try to get laser focus on how we can make a change,
Yeah.
and that's working through our PA legislators. But you know, it's like turning a ship; they don't turn on a dime. You got to. It takes time, but we're just going to keep pulling on that wheel until we're headed in the direction that we want to be headed in. Because unfortunately, like you say, our community of color, with our kings and queens and princes and princes, they deserve it. They absolutely deserve our attention and our blood, sweat, and tears. Simply because if we don't fight for them, nobody else is going to fight for them. And not only that, but guess what? We're fighting the good fight. Like we're getting in good trouble. That's a good thing.
I know good trouble is good.
Exactly.
But I want to go back to data because SCDC and CDC, they're about the data. We need numbers. And so this is a real thing. I mean, doing what you all are doing, I'm going to talk to you offline. We're going to write it down and figure it out.
Right.
But
Oh,
data drives getting financial support.
right.
So where do they begin? You have thoughts and suggestions, or has anyone talked to you guys about that?
Well, we are a part of another grant opportunity, and Andrea kind of heads up the data collection team of that. It's a HRSA grant, and they are really looking at a lot of places. And Dr. Rowley, you probably know, and Tristan, you as well. A lot of places want to come up with a registry, and unfortunately, that has never really worked out for us people, our people. It hasn't worked out for us. I mean, if you know my address and where I am and all that, for some reason, we just get a bad feeling about that. I think anytime you're dealing with a large institution, we don't want to be marginalized, but at the same point in time, I don't want you to be able to know everything about me, know my credit score and where I live and who I'm married to, and that goes a little bit too far. So we kind of, I think we like our independence. So what we're trying to do, Andrea and them, they're trying to come up with a data point that if you want to be included in this, I don't even want to call it registry, this community. If you want to be included in this community, feel free to. And the reason that the behind it is that they can make sure that the right public dollars are going to the right places for the right services. Um, just Andrea and I about a year ago came up with a 1855 sickle 8 line, and it's a what it is if you call this number 1855 sickle the number 8, if you dial that number, we will try to find a qualified care center nearest you. So it might be 200 miles from you, but guess what, that's the closest one that is going to have in-depth knowledge about sickle cell disease. um, it's just we think, because that's all we could do, taking these little baby steps will get you to that point. Like now, Dr. Rowley, if you call that number, it's going to challenge our CHWs. We need to find a qualified care place closest to Dr. Rowley in California. So we sometimes need to stretch ourselves and make sure that we are doing all that we can do. Like if you were calling from North Dakota, you might have to drive 400 miles. I don't know if there's even a place in North Dakota, just because of I don't know how much of a color community they have in North Dakota, but nonetheless, I can tell you, you got to drive in Nebraska to get to one. You know, that's what it is. What it is. But at the same time, little steps like that, I think we're getting better. And Andrea's working on a data collection service for HRSA, the Health Resources Service Administration, where people can opt into it. And it'd be a 100% secure facility. So no information, we're not even going to de-identify. You know, they always tell you, we'll de-identify your information and nobody could get it. You know, that's just like they do to me. The next thing I know, I'm getting a phone call saying, "Hey, trying to sell me something." No, I don't want any of that. So we're trying to do this once again for us, by us. You know, just so we can make sure the right services are going to the right place and the right funding, or the funding is going to the right area. You were going to say something, Tristan?
Oh no, I was gonna say so. That's amazing that you guys have that 1-855 sickle 8 number. Now, is there an email address as well that people can kind of reach out to, or a family member could reach out to, or something to go along with that, or like a website?
We don't have a website. Well, once you call, what's going to happen is once you call the number and you say, "Hey, my name is Tristan Lee. I'm calling from Allentown, um, and here's my number." All you gotta do is leave your number. A certified CHW will call you back and work with you one on one to find that nearest care facility that's closest to you. Now, and then they will also make a warm handoff. So we'll call somebody, we'll call the care center, we'll triage the care center, and then we'll say, okay, we'll call you back, Tristan, and then I will call the care center with you on the phone to get you connected. 7 to 10 days after I get you connected, I'm going to call Tristan back and say, "Hey, how was your experience?" Because we want to close the loop. We want to make sure, because you might come and say, "Oh, Mr. Mike, once you got off the phone, they treated me like garbage." Okay, then guess who I'm not using anymore? That particular care center. Um, so, like I said, we're doing everything that we know to do. I'd be interested to know if anybody has any suggestions, because the only bad suggestion is the one you don't give.
True, very true.
I have a quick question.
Yes,
Going back to data. Um, so we're thinking, Kaya Wellness Center, of doing a survey. But again, we don't like to reinvent the wheel. Have you all created such a survey to reach out to folks in Pennsylvania to see who's ever been in prison, to see how often they've been, to see how their experience has been, etc.? Have you all done that? Because we're thinking of doing that.
you know what? We have not, and I would love to work on it with you. We have not, as far as uh, because it gets kind of, once again, that's one of them situations where a lot of people don't want to let you know that they've been
I
incarcerated.
know, but we can't help you if we don't know. We remember I need some numbers.
Right,
So if I know that in California, I'm not trying to get into your business. I just want to know if you've been incarcerated and how was it, so that I can
right.
get some numbers so that we could, fuel this back to SCDC, Jacqueline there and Mary at CDC, because I think we can, if they can, see these numbers, maybe we can get then funding so
Well,
that you guys can continue what you're doing, so that we could be your West Coast partner in terms of what we're
right,
doing. But most monies that we receive, no one thinks about for the incarcerated.
right.
These
Well,
are,
here's a great question I have you. I'm sure they have numbers, and since we're all family on the call, they have numbers about what percentage of the colored population spends time behind bars, or is incarcerated. They might have a percentage.
who does that?
Well,
Who?
I don't know, but I'm thinking, I'm saying to myself, if the CDC or someone says, hey, people, this is how many this is how many people of color. Just say we have living in California.
Mm.
2% of them, 2%. We know that I'm sure they have a percentage of people of color and how many people have sickle cell disease.
So like a census.
Yeah, well, they do.
Yes.
They do. SCDC has, they did California and Georgia first. I believe they've added on, Jacqueline, you can correct me, I think 7 other states now. So there is data on in terms of how many persons have sickle cell disease. And so in California, it's about 7,000. I'm not familiar with Georgia, but I know they have those numbers. So they do have, not based upon ethnicity per se, but how many people have sickle cell disease. That when they go to the ER inpatient, they're able to look at that because of Medicare and all of that, right? So you're wanting to go a little step further. You're saying in general population, how
Right.
many persons who are African American, Latino, etc.,
Right.
to be incarcerated, and then try to extrapolate from there?
Right. Because it's, you can reverse engineer a number. You can reverse engineer and say, okay, if if 20% people of color, I'm just putting out, say 10% people of color end up in prison at some point in time or end up incarcerated. 10%. Okay, well, we know that it's, even if it's number like out of 365 people of color have sickle cell disease. You see how I can backwards reverse engineer and extrapolate a number like this means that there's probably in California, you could probably have had on a, I would imagine a number somewhere like 600 people throughout the course of a year that are going to jail spend time in jail or incarcerated that have had sickle cell. Now you might have been in there for 2 days. Some people are in there for long stretches, but I'm sure you can kind of get a ballpark on how many people that is. And I can't even imagine because you guys have so, we have a lot of jails in Pennsylvania. We have more jails than any state. Uh, but you guys have more people in any state. And it's kind of interesting, but yeah, I mean there's a reason why the American Society of Hematology (ASH) has a standardized care package. And I don't see why. Like I said, it's just like dialysis. If you were to, not that I know much about that disease or that situation, but you don't get a choice whether you're dialyzed or not. You don't. You go every 3 days. You might stretch it out one day because of travel to a fourth day, but you're not like, I'm just going to skip this week. You're not doing that because you probably won't be here next week. You know what I mean? So that's how I think about it. It's like, I want sickle cell to be on every level. I want us to be treated with the utmost respect and care given to our situation. Um, so I would imagine there's some people who probably went to school for a very long time just crunching numbers. They could give us some estimates on how many people in Pennsylvania, in California. We know there's. I can start you off right now, Dr. Ali. There's about 100,000 people in the United States
Hmm.
with sickle
Yes, there
cell.
is.
Now, where are they at? I know in Pennsylvania we have about 4,400. Now, but there's 50 in North Dakota. You might have 4 people. Yeah, I know you ain't got a bunch in North Dakota because my grandparents are from there. So, when I look around, it's like, now you got Georgia, you got California, you got Texas, you got Chicago. And Dr. Riley, we got some powerful partners in Chicago and Ohio, like Andy and all of them, that are friends and family. Um, I think we could do this.
Definitely. And I'm seeing right here in the chat. So your lovely wife Andrea said the toll free line is 1-855 sickle 8. Um, That is 1-855-742-5538. Is only available for PA residents. If they text the word sickle to 66866, we want to be clear. Anyone can call, but they will be rerouted to a CBO nearest to them. So that's important to know.
Right.
That's actually
I
very
love that. And so, I'm
But
sorry.
what we're trying to think of, Dr. Rowley, we have Dr. Stewart out of HRSA, I believe she's at. We were thinking about broadening this, uh, like the 1-855-608 to be a national number, and they're looking at that. Like just like you have suicide hotline, they don't have different numbers for everybody. You can call from anywhere you are, and you're going to get them. And we want that to be the same. But like I said, we have to start small and then grow out, and that's what we're working on.
And speaking of growing out, it just occurred to me like you're doing this right now for the Warriors in Pennsylvania. And of course, it's going to go on to other Warriors in other states like California
Right.
and where have you. But I always think of the broader picture. So let's say, would you be willing to maybe take this abroad? You know what I mean? To like the UK? Will this be available like internationally? Because I know there's sickle cell warriors around the world, right?
Right.
And this I feel like is going to be such a vital thing that it's going to, I believe, become so mainstream that your services are going to be needed internationally. So how would you guys like handle that situation if it grows to that level?
Well, if it were to, that'd be a great problem to have. Um, I'm gonna tell you, I got $5 in my pocket, and I'm going to play the Powerball again today.
Yes.
So if we get blessed, we won't. Don't worry, it'll be that 1-855-608. Everybody and their mother will know that number, and they'll, like I said, it'll be on balloons and blimps and
you're
you know
funny.
mailings. So and that's all we could do, like I said. But it really, once we get the once we get it figured out the best that we can for right now, I don't think that a year from now, even though if we are global, Andrea has traveled to Ghana, she's gone to Brazil. I mean, she's been all over the place, but we just want to make sure that we get the best package that we can for right now. Like right now, we're looking at Pennsylvania, but Synergy, which happens to be a group out of Maryland, CBO, the Karen Proudfoot organization, they're thinking about doing it for the whole Eastern Coast. Like then it becomes regional, then it becomes so we just have to grow in that way. But that's why I'd be more than happy to work with Dr. Rowley on anything that we can do to look at the number. But I would like somebody from for me to be able to get a representative from Pennsylvania to call representative from California and say, hey, this is really working for us with our penal system. These people are getting the care they need.
Yeah.
Now that person in California would be more apt to receive it in a good way. Say,
Yeah.
oh, it's already working for you guys. Well, what exactly are you doing? As opposed to, oh, we're just in the incubator stage and just trying to roll this out. So, like I said, but we're willing to share with anybody what we've done, what we're doing, and that's why I'm always asking for please give me comments, feedback on what we could be doing differently, or because differently doesn't mean necessarily mean better, but that means it doesn't necessarily mean it's not better either. So we'll try. We'll try. Just to make sure we can get them the care that they need.
I love to hear that. Um, Dr. Rowley, there is a comment here
Yes.
for you. It says, let me see.
Oh, yes.
How,
I saw
okay.
that. How can
So,
how can care be, oh, I meant to come back to it. Thanks, Devo. How can care be evidence based in this context when data collection/research is so limited, plus persons living with sickle cell are living much longer. Thank you. So I think when I mentioned evidence based, I was referring to NHLBI and ASH guidelines. That was the first thing, and so that was my initial thinking. When I saw this, I was first thinking, are you saying um, because we haven't had data collection yet with the incarcerated, would that still apply? And I thought that the question was excellent one. So I'm not quite sure I'm not really quite sure how to respond, but I think it's great to bring up. And for myself, for the ER, for inpatient, we do know what evidence-based care looks like. We do know what great sickle cell management long term should look like. However, I guess my thought is when you're incarcerated, before you were incarcerated, hopefully you were receiving evidence-based care.
Right.
And so then you're being placed from within your home to behind bars. My thought is, shouldn't it still be the same? Shouldn't they still expect to be able to get their pain relieved? I think that's where it comes down to. Evidence-based care just means being able to provide pain relief that works. I always reference Jeffrey Glassberg's article. It's an excellent article in improving emergencies care for people with sickle cell disease. And he says it very succinctly: believe them, give them what they ask for, check on them frequently, and then you can start tapering. And 90 plus percent of the institutions get it wrong. They want to give you point 0.2, maybe give you point 0.5 dilaudid,
Right.
and they're inching up. Now it's days. And so by the time you finally get what you need, which is maybe 2 milligrams, now 4 days. And so most institutions do it backwards. And
Hmm.
so I always mention Jeffrey Glassberg's article is excellent. I It needs to be part of standard of care that people receive in terms of how to do it. But with respect to the prison system, the question is a good one. I don't know what that should look like. Um, I think what I'm hearing from you, Devo, from your mom's experiences, they're not even getting adequate care.
Right.
They don't even have a wheelchair to be able to help them from their cell to the ambulance. Come on.
Yeah, it's just horrible. It
Well,
is like,
one thing I wanted to add, and it was one of the things that the adult clinic was really working on is how could they, because you have public health information, PHI, which is very protected. How could I, let's just say, Devo, if you were in a hospital, how could our adult clinic send over your care plan? Because one thing we did find out, and it hit me, the fact that when our doc, Laura DeCastro, said, I want to come on a personalized tour of your facility. Oh, they rolled out the red carpet. I mean, you would have thought her last name was Obama. She was walking in there. They showed her everything, and I'm sure they had everything cleaned and wiped down. And I would hope it's like that all the time. I can't speak to it if it's not like that. But doctors love talking to other doctors. They give them each other them. That's why I would like you, Doctor Rowley. You're always going to be Doctor Rowley. You're never going to be Carolyn to me because if you got a DR in front of your name, I figure you deserve that respect for all the work you put into it. But when you talk about medical doctors, that's a whole different level. They just love talking to each other and don't really want to talk to anybody else. So I can call and say, hey, I'm Mike Matthews, Children's Sickle Cell Foundation executive director. They're thinking, did he say doctor in there anywhere? Because if he didn't, I really ain't got to pay that much attention to him. That's my general belief. But just them, like I said, having a care plan that they can send over and say, hey, this is what Devo needs to break through his pain episode. And then hopefully over time forming a relationship with the adult clinic here in Pittsburgh, so that when Terry or whomever calls, who's ever in that position, they actually believe them. Then they don't start you off at a two, like you said, Dr. Rowley. They're not knowing that your breakthrough is an eight. They're going to start you off two, and they're going to go up every 6 hours. It's like it's going to be 2 days before I even get to where I need to be. So that's definitely, I appreciate that comment.
Thank you. So we are going to look at the comments. Carrie Valentine, and hey, Carrie, she's one of our on our advisory board. She says this mini seminar has taught me so much. I am ready to work with the committee. Guess what, Carrie? I'm calling you. Okay.
Yes.
A great team can make a difference. Thanks to all three speakers for elaborating on this topic. And on that note, so again, I'm going to be reaching out to you, Michael, because we're going to start a task force. It sounds like that's what we need to do first is get everybody geared up to identify what roles they need to, what roles they're going to play. And then after that, like you said, to be able to um, actually, you guys have 57. We need to figure out in California how many actually do we have, and then
Mm,
find out who the CMO is, as you said, of all of those, and then to get a doctor to be able to speak with that doctor
Right,
about. And I don't know, I'm conscious now by saying evidence based, but at least sharing standards of care
mhm.
with those particular institutions. And so that would be wonderful for us to, for anyone who would like to be part of that task force here in California. We're ready for you because I've been thinking about it for 5 years, talking about it with Jacqueline for about three, and with Mary Houlihan at CDC. It's time. And we are going to do a survey. So, Michael, expect to get a phone call as well to figure out how we're going to do this because we just want to know. We're not trying to dig deep. We just want to know if you've been in. Sorry about that. But we just need to know the numbers because the numbers will drive support.
right. I do know
Absolutely.
that. I do know that here in Pittsburgh, we do like ED visit care, like because everybody's been to the ED. Matter of fact, the first question is, have you been to the ED in the last 12 months?
Okay.
And just
Mm,
we do ED care surveys so that we can reach out to the different hospitals and things and say, hey, this is what you guys are doing really good. We might also say, but you could spruce up your bedside manner according to our warriors. They're saying that the bedside manner is not really good, or vice versa, whatever it may be. But like I said, we would love to work with you on this. We could be bi-coastal, and just like I said, if we're doing something here in Pennsylvania, and we can do something great in California, and then we meet in the middle, our warriors would be much better for it.
yes, I love the collaboration. I love it all. And actually, I was going to say that too. Like up here in Williamsport, Pennsylvania, where I am, I have a great team of medical professionals and doctors. And my doctor is actually the head of our UPMC. So there's always, if you need that support, I can get you that contact, and we can just continue to build the bridge. So just let me know.
Thank you. Pat has said a quote saying, "For God has given us a spirit of power to turn stumbling blocks into stepping stones."
Amen.
Yes, I'll repeat that, okay? For God has
Yes.
given us a spirit of power to turn stumbling blocks into stepping stones. I like it. And that is by Joseph E. Lowery. Wonderful.
Powerful.
Wonderful. So, wow, this has been, everyone's loving the conversation. I think, namely, I have to be honest, I think everyone at some point in time has thought about it. Um, they haven't heard about it, but they probably thought about it. They may have heard someone had went in, know someone that went in. And I always was just curious. I hope they're okay.
Right.
Mhm.
I hope they're okay. We just don't know. It's like once they go behind bars, we don't have any information unless you're on their list to be able to visit.
Right.
Mhm.
And it's almost as if they have been removed, which is, I think, the whole purpose. They've
Right.
been removed. But guess what? In the sickle cell community, you are not forgotten.
That's right.
Absolutely.
And we
That's
want
right.
them to know we do not forget. Look, I knew someone that went in, and constantly I was just continuing to pray. When the person finally got out and they called, I said, whew, I am so thankful to hear your voice. I
Right.
really was so thankful. But now, as a returning citizen, it's now about getting housing,
Right.
getting the Medicare back turned back on,
The employment. Yeah.
all of that, all of that. Oh my goodness.
You know, one of the things, and you would be a prime example, Dr. Rowley. You know, it's something we never look at. A lot of times, our community, we look at, and we should look at, but we should look at all of it. The squeaky wheel always gets the grease. We'll get the kid that's not doing that well in school, and he'll get special, privileges and extra set of books, and he'll get all this. But what about and I'm thinking about for sickle cell, what about our warriors that are doing really well, that are living well with sickle cell? We really need to survey them and find out how are they doing it, because we need to share that with the ones who maybe they're like, oh, I drink 2 bottles or 3 bottles of water every day. I mean, it could be something that simple, especially to that person who doesn't drink water and is dehydrated and it ends up in a situation where they're in the ED or something like that. Really taking a look at some of and we understand that the environment makes a big difference. How well you're living. Are you living in are you homeless, or are you living in a house? Now that I can see that can have a very, very big effect. But we really need to start identifying some of these wellness goals that some of our warriors are living well with sickle cell. Maybe because not only it could be genetic, it could be anything. But I got 100 people here who go to the hospital once a year. I got 100 people here who go to the hospital once a month. Okay, what's the difference? They're the same age. You know what I mean? Like, with maybe their employment, maybe one takes public transportation to work, so they're dealing with the elements a little bit more than someone else. We never know. So I think there are so many things that we could look at and uncover. And some people are doing all the right things. They just have a tougher time with sickle cell because, like we always say, it's a thumbprint disease. You probably heard me say it 1,000 times, Devo. It's different for everyone. I literally have about 4 or 5 sets. Either there's multiple people in the household who have sickle cell, but they have totally different. I literally have 2 sets of twins, and one of them is always in the hospital, and the other one is hardly ever. They live in the same house. They eat the same food. Everything about them is, matter of fact, like I said, they're twins for crying out loud, except that they're a boy and girl twin set, but they have totally different, situations with their sickle cell. So,
Well, you just
Right.
mentioned something. Well, first, they may be in the same house, but just because of their makeup, one could be more anxious than the other or depressed than the other. There could be other things happening. But you just mentioned something about male, female. And you know what? There is a difference with men and women living with sickle cell disease.
right,
And what we've seen is that we don't see males. They're not registering on any of the data.
right.
Um, However, I'm sure that there are more males in prison than females.
Absolutely. Absolutely.
Definitely.
Absolutely. I would imagine it's probably when you talk about the incarcerated population, you're probably talking in upwards of probably I wouldn't be surprised if it's like 7-1, to be honest with you. But unfortunately, that's because there are so many of us males of color who are in prison. You know what I mean? I think if there's, I wouldn't be surprised if there's seven, because I could tell you just in my thing, I'm my short term memory here, there were seven guys over the last 6 months, seven guys, and there was one girl,
Mm,
one woman who was locked up. So, I just speak, and I'm sure that's different everywhere, but it's kind of a quinky dink that I'm thinking about this. And it was 7-1 6 months ago when we had that type of a population who happened to be in the situation that we're talking about.
But
yeah, and
So,
also,
go
I'm
ahead.
sorry. No, I was just gonna say real quick. Also, the fact that black men are targeted as opposed to a black female, so that's another factor that goes into that too.
right.
And I want to know, how do we get the black men living with sickle cell disease to come on in? Like you said, their family, they're kings, princes, and we want to love on them and hug them. So
Right.
I'm calling it out now. If you're listening, please come because we love you and we care about you. How do we bring them in? Because they're not registering in terms of the ED, they're not registering in terms of inpatient, they're not registering. We don't see them, but we know they're there.
Well,
Right.
I can tell you this, but I do know, and this is just my own little, I've been going back and forth. Most male, in my experience, most males living with sickle cell, most of our warriors, I shouldn't say that. I want to say overall, men and women, when they don't have to deal with sickle cell, they don't want to deal with it because they know when sickle cell rears its ugly head, they have nothing else to do but deal with it. You know what I mean? So, in other words, don't remind me about sickle cell all the time, simply because when I'm sick or when I'm in crisis or something's, I have an infection, whatever it might be, it totally consumes every fiber of my body. So when they get a chance to be away from it, they want to be away from it. How do you think about that, Tristan?
I mean, it's true. And there's also that don't ask, don't tell factor. Like, I've heard so many different warriors, especially the men, that kind of like, they don't really want to, they didn't put their status out there because they don't want to be seen as less than, they don't want to be seen as, they can't provide or be, you know, um, well, the overall provider of their family, like men are, supposed to be, as some were raised. And it also goes back to that, strong black man thing. You know what I mean? Like, as black men, like, we have been taught by our fathers or other males that, you know what I mean, you hold down your household and you take care of your family and this, that, and the third. And I think that mentality has kind of unfortunately bled into other aspects of our lives. So when a sickle cell male does come into crisis, it's looked at as a weakness, which it really shouldn't be. It's just that, okay, I need a little more help right now. So as soon as I get my help and I'm back on the level to be the provider and protector, like, you know what I mean? We can do that together. But until that happens, that's when you should really lean into your queen or your other king if you are LGBTQ, and just kind of let them help you and lift you up, because every sickle cell warrior is different, and we know this. You know what I mean? Like, me, myself, I am one of the ones who live very well with sickle cell. Um, Hydroxyurea has done tremendous things in my life. And I mean, to the point where my last hospitalization, thank God, was 2016 with a
Wow.
pain crisis. But hydroxyurea, you know what I mean? I do well with that. But other warriors I have heard cannot, take hydroxyurea. And it's just one of those things. So saying that every single cell warrior is different is true. And I just feel like we really just need to kind of meet those people where they are, You know what I
Mhm.
mean? And I'm in a group of sickle cell men warriors that are men, and we continue to have these conversations. You know what I mean, about more men coming into the community, but at the same time, like I was just talking about, there's that barrier of like, we have to be, the head of the household and stuff. So I know that they want to show up as much as the females, and I believe that this year, if it's up to me, I'm going to really try to, help them to cross that barrier and bring more men into the community, or be seen on the outside of the community and in the public limelight, because it's so important and it's so needed. So, man, this is a call to you, and I'm going to get in my group after this and
Yeah,
be like, yo, like, we
yeah.
need to step it up. You know what I mean?
And Devo, and you can say, and where were you for the mini seminar held by Kind Wellness? And
Yes. And I'll let them know about the upcoming ones as well.
Well,
wow.
well, you know something that I found that worked, and you guys please take it if it works for you. We started a group. It's called our empowerment group, and it's we divided it between men and women. You know the way I get more the men to outnumber the women. I turned it into a competition. I
Mm,
turned it into a competition. Like our program director Ty, I say for every woman that you get to come in, and these and they could either be a warrior themselves, or they could be a parent of, they could be a mother of a child. So you're warriors too, whether you know it or not. You are, but I would spur the men. I'm like, man, they had 15 people on the meeting. Don't y'all gonna let them women just outdo us like that? Like we a bunch of deadbeat dads. They took that stuff personally. And
mm-hmm,
now it's been about 18 months. Every month, I make sure we have one or two men more than the women have. And then we report back to each other, because she's constantly talking to the mothers and the women warriors saying, man, the guys are just like killing us. They're showing up. So when we have events like right now, the weather's getting nice. I got guys on the grill. They're setting up the tents. They're doing, and these are parents and or their male warriors. And just that competition. That's something that we use to kind of just. It's nothing but love, but we're all out
mm-hmm.
there for a great reason, a great cause.
Exactly.
Wonderful. Okay, we're going to use that strategy as well. And I do miss the in person, because we
Oh,
used to have we used to do dinner and dance. We used to actually have a picnic. So I'm hoping that with 2024, so 4 years,
right,
since COVID, maybe we could do that and make it a competition.
right.
I see something in the comment from Shondell. Hey, Shondell. For me, with my son, I made the decision when he was diagnosed to share and openly talk about him and his obstacles, which has made him grow to be comfortable to share and speak about his health. Um, Thank you so much. Her son's name is Isaac. They're awesome family. And I like that. If you make it part of your just who you are as a family, then it just becomes easy to just be that spokesperson as you continue to live your life and as you grow right through the lifespan. And because it's nothing to be ashamed about,
No,
nothing to be ashamed about. As a matter of fact, in terms of traveling, I love traveling because I get to tell people, the Uber driver and everybody else, this is what I do for a living.
right.
And so we talk about sickle cell. It's just another opportunity, and nothing to be ashamed about, no judgment, just did you know? And do you have sickle cell in your family? And so we just talk about that. Uber driver, the Southwest flight attendant,
Right.
which are I think they're closeted comedians. Um,
Mm-hmm.
Southwest flight attendants. They love to uh, they love to tell joke, and so I think they're closeted comedians because they're very funny. And but it's a perfect opportunity to let people know. Um,
A
thank
lot of a lot of people want to know about sickle cell, but a lot of them are afraid to ask.
oh
So
Yeah.
the fact that like like a lot of our programs, we do kids and sibs. So when Jonathan, he has sickle cell, but he has three siblings. He has two sisters and a brother. So we would go to things like to the Power game. And so the reason that we were able to go and we were to take the whole family and other families come and they come to our Kennywood Day and all of our Power games and football games and they do all these fun things in our family reunion, it becomes a positive. It's like, oh, well, how did you get to go to that event? Oh, my brother has sickle cell and it's part of sickle. But they become our ambassadors about sickle
Hmm.
cell. We're always sharing some education with them. So it doesn't become such a taboo topic. It'd be just like, oh, I got three sisters and one brother. My one sister's left handed. That's how we treat it. She just
Yeah,
happens to be left handed. And that's all it is. It's something different about her than the rest of us, but we just keep it moving as a family because once again we're all family.
I love it. I might use kids and sibs, so I'm saying it out loud.
Okay.
definitely,
I
definitely.
like that. I like that.
Right.
Well,
Yeah,
well, we're
I
we're coming up on the hour. We have about this has gone. Oh, this was so awesome and phenomenal. And guess what? We get to do it again two more times and dive
yes.
a bit deeper. We have about 9 minutes, but after 1 o'clock, if we keep going, we call it linger longer because we know that some people have things to do. This has been wonderful. Tristan, you've been an excellent moderator. Of course, Michael,
Thank you.
you guys always show up, you and Andrea. But go ahead, you were going to say something.
Me? Oh,
Yeah.
I was just going to say thank you so much for having me. I learned so much. I see somebody asked me to share my email address. My email address is divo star 28 at gmail.com. And you can reach me there anytime with questions or any way I can help. I will definitely help. And this is what I do. I love spreading sickle cell awareness and just, continuing to have great conversations like this. So I'm just, thank you so much for letting me be a part of this. And
And then
Michael and Andrea, I love you guys so much.
repeat it again, Devo Star 28.
Yep, devostar28
At
at gmail.com.
perfect, perfect, perfect. Let's see, do we have any other comment questions? Oh, and I do have to give a shout out to Etta. Um,
Hey.
Etta Carter. She's at every, we love her. So she's at our very first educational seminar, which is our mini seminar right now. So shout out to Etta. And let's see. So that was Carrie that asked you for the email address. Wonderful. Pat Corley says, I love you, Devo. You shine your light so brightly and it resonates. You make my
Oh,
heart smile.
thank you. I love you too.
Wonderful. Hey, Michael.
Yes.
So as we close out, and this is just part one of three. So we have two and three. And Devo, we hope we can get your mother
Oh
on
my
to
God, she would love that.
With Ms.
okay.
Ms.
And
Deb.
what we're wanting to do, Michael, I know someone here, and maybe Michael, and this is only if this is kind of tender. This is only if the person who is now a returning citizen
Okay.
wants to be able to share their experience.
Right.
Um, up to them. It's up to them to have the camera on or not. I think though we could learn about what it's really. I mean, not so much what it's really like because we hear, but they live that.
Right.
I think it would be helpful, but only no pressure at all, only if they want to be able to share,
Right.
because I think it ultimately helps with standards of care. But I'm going to actually find out what do you want to leave us with? How do you want to summarize our time together today?
I really appreciate you guys and everyone who chimed in and decided to take a moment out of their day. This topic is so very important, not only in incarcerated, but just a fair treatment of individuals who might be different. In this case, it's sickle cell disease. So for so long, we've been behind the curtain in the basement, afraid to speak up because we haven't been open with, we haven't been welcomed with open arms. And like I said, if you know of someone who is living with who has sickle cell disease, they are so deserving of your attention and your time, not to mention the blessings that you're going to get back from it. I mean, because I know, I can't imagine between Devo and Dr. Carolyn, uh, I know so many rock stars because of this field that I work in, along with my son. It's just a blessing. And it's sort of like you can travel wide and far and you can search for treasure. And maybe sometimes you just need to stop and look around you and appreciate the treasures that you already have within the arm's length. And then once you hug on them, just hug on them and grip them a little tighter. Like I said, there's nothing bad about a hug, nothing at all. And I look forward to seeing you guys again. So I want to thank you so much, Dr. Rowley, for inviting me. Of course, Devo, I'm gonna have to get used to that name, but
You, you can always it's just Tristan. I should
yeah,
have just
all right, good.
Devo is what they call me in the industry, like the entertainment industry, but it's always just Tristan, the family.
Well, Michael, you can just say family.
There you
I'm
go.
family. You know, I know Miss Deb, his mother. I'm like, that's just family. I mean, I figure
Right.
if I go to the eastern part of the state, I got a place to stay. I don't know. I'm good.
Absolutely. Two places.
Right. Well,
um, Dr. Rowley, before we go, do you want to talk about the survey?
Oh no, go ahead. I was just gonna dive in. Go ahead and mention it.
Okay, so the virtual survey event is at https semicolon that slash vr2 dot vr or verticalresponse.com /surveys answers A4LMWKFAWN underscore LN38AGCJ underscore F hyphen 4H9LIFDM hyphen MZEWMPYPZAH 0 percentage 3D.
Whew, mouthful. So what we want you all to do, it should be available on Facebook. You should be able to just click it. If you're here, you should be able to click it now. And then even afterwards, if you have registered, we're going to send it. Because guess what? Just like Michael said, we listen to you all. We listen to you all because what good does it do to create something and it doesn't resonate with anybody?
right.
Just a
Right.
wasted energy. But we knew that this was something that needed to be spoken about, and we're so glad that we did. So as we wrap up, and I would like for Devo, Michael, for you guys to hang out a little bit so we can just kind of wrap up a little bit. But for
Mhm.
all of you guys who joined us today, um, I'm so happy. This is
Yes,
what
just
makes
such a blessing.
me smile. Doing things like this, where the conversation was so rich and enlightening. And of course, we expect nothing less from Miss Brandon. This is wonderful. So I look forward
Mhm.
to Cayenne being able to partner with you all and having an East West Coast thing happening, putting
Yes.
together that task force. We're happy that you guys are actually here. So join our e-newsletter so that you can find out when we actually have other mini seminars, also the upcoming summit. And then, Michael, I didn't actually tell you this, but um, y'all might be coming out to California because we actually do have a session on care for the incarcerated. And
Hey.
so we really plan on expanding this. with the hopes that if we can get this survey up and going, we would get about 5 months of data so that we can actually be able to share this. So you should be hearing from us with respect to how to be able to do a session at our upcoming summit in September.
I
So,
would love to come. I would love to come out to California.
yay.
Me too.
Yeah. So, with that, everyone, we're so glad that you're here. Again, Devo mentioned it. The survey is so important. So important. If you are registered, please take it. It doesn't take that long. I promise. I'm a person of efficiency. It's not going to take you that long. So please fill that out. Um, and we won't read it, but you should be able to just click it, whether you're on
Yeah.
Facebook or streaming some other way or right here with us, you should be able to click that. So thank you very much. We're glad that you're here. And we're going to end for today, this afternoon. Thank you so much.
Thank you.
Thank
Be
you.
well. God bless.